The First Lady of the Federal Republic of Nigeria, Senator Oluremi Tinubu, represented by Laila Jibril Barau, has charged Governor's spouse to jointly tackle drug abuse in the society, provide drug prevention initiatives, advocate for the voiceless, and provide community interventions. Also disclosed that the workshop organized by the National Drug Law Enforcement Agency for the governor's wives will fortify them to tackle and prevent intake of illicit drug in their society. Speaking during a workshop on community-based drug use prevention and treatment approach held in Abuja, the chairman and chief executive officer of NDLEA, Brigadier General Mohammed Buba Marwa, has disclosed that the NDLEA has arrested over 62,000 drug suspects, including 68 drug barons, recovered over 10 million kilograms of assorted drugs, and secure conviction of over 11,000 offenders, amongst others.
Let us always bear in mind that as state first ladies and mothers, you owe our people the duty to lead by example, to bear their burden and share in their pain as we jointly confront drug abuse in our society. I urge us to continue to provide the right direction through prevention initiatives, advocating for those whose voices have been silenced by addiction, providing community interventions to support recovery and reintegrate people into communities after treatment. In conclusion, let us approach the formidable task ahead with humility, doggedness, and commitment to enable us build communities where our children are protected from harm and empowered to thrive. Together, we can change the narrative, restore dignity to our communities, and ensure a healthier, safer future for all Nigerians. Today's training will ensure that we are adequately armed with the right knowledge, tools, skills, and competencies necessary to effectively tackle this complex issue. It is my hope that this capacity building workshop, through honest discussions and sharing of best practices, will provide valuable insights into evidence-based strategies for prevention, early intervention, and holistic treatment approaches, especially targeting marginalized and vulnerable communities. I urge us to utilize the knowledge gathered at this training to develop viable solutions while collaborating with relevant stakeholders, especially the National Drug Law Enforcement Agency, other law enforcement agencies, MDAs, civil society organizations, healthcare providers, educators, and community leaders. As a nation, we are confronted with a growing crisis, one that affects the very core of our society, the health, safety, and future of our children. The rising tide of drug and substance abuse amongst adolescents is a challenge that we must no longer ignore or tackle in isolation. It requires concerted efforts, community-driven response, one that integrates enforcement, education, family support, and sustained intervention. On this note, I declare this workshop on community-based drug use, prevention, and treatment open.
Over the past 4 years, the NDLEA has deployed substantial resources towards a comprehensive assault on the drug problem, yielding significant outcomes. Under the drug supply reduction mandate encompassing drug seizures, arrests, prosecutions, and convictions, we recorded in 4 years the arrest of 62,595 drug suspects. This number includes 68 drug barons. We don't only go after the small people, we also target the kingpins. Very recently, we had one of our most successful operations of a getaway criminal who was jailed in South Korea. He served his sentence and was deported. 17 years, as soon as he came, he continued the trade and expanded to other African countries, shipping to South Korea. And the Interpol, the South Korean intelligence, and ourselves. 17 years that we were able to get him 2 months ago. And the South Koreans sent a delegation to me to appreciate what we have done. We've also within this period seized over 10,000 tons of assorted drugs and secured the conviction of 11,628 offenders. Furthermore, 1,330 hectares of cannabis farms were identified and destroyed. So we not only wait to arrest on the roads, in business places, in warehouses, and the cannabis, but we actually go back to the plantations themselves, seek, identify, and burn them to ashes. And those arrested, we prosecute. Between January 2021 and March 2025, a total of 24,375 drug users received counseling and treatment at NDLEA facilities, majority of them through brief interventions. I'm happy to say that with the support of His Excellency our President, this year we are going to upscale the counseling and rehabilitation centers, which up to this moment there are 30 commands out of 37 state commands. This year, by the grace of God, we will add 7 more to make every state and FCT have a counseling and rehabilitation center. We will also start model zonal rehabilitation centers. It's on our budget, and at least we aim to do 2 or 3 zones this budget year. We have to remember the connection between drug use and the criminalities, the Boko Haram, the insurgents, terrorists, kidnappers, the whole lot. There's nothing that propels and instigates criminal activities more than drug abuse. And for which reason, we all must remain obstinate to fight this scourge. We have conducted 10,500 drug sensitization programs nationwide under the auspices of the War Against Drug Abuse social advocacy campaign, reaching diverse target groups within communities. So I'm speaking about advocacy visits to schools, marketplaces, churches, mosques, motor parks, traditional rulers, security organizations, workplaces, and so on and so forth.
Furthermore, Buba Marwa revealed their plans on rehabilitation center and treatment. Also urged governor's spouse, stakeholders, and others not to relent over tackling of drug abuse.
Your Excellencies, your roles as mothers, changemakers, and drivers of the state drug control committees place upon you a sacred trust, a responsibility not to be borne lightly. Through your ingenuity, your states may yet emerge as shining examples, immortalized in gold as bastions of hope that defy the tides of darkness. This workshop represents a stride in the proper direction. Since it is at the community level that the burden of the drug menace is most acutely felt, it is vital that stakeholders, including all of us gathered here today, address the different dimensions of the problem from a community-centered perspective. This gathering will strive for common ground, developing indigenous and pragmatic solutions that go beyond mere statistics and harrowing headlines, and addressing instead the real and harrowing human toll of drug abuse. I am confident that this training will strengthen your abilities, harness community resources, and unlock the potential needed to formulate and implement evidence-based interventions that will salvage and rejuvenate every segment of our beleaguered communities. I must fervently implore you, Your Excellencies, to ensure the establishment, strengthening and revitalization of these committees across the states. The case of the state drug control committees is one of mixed blessings. So far, there are 9 states that are actually effectively running SDCCs. So the majority of the states do not have functional SDCCs. This is a crucial platform in the war against drug abuse at the structural levels. And before your departure today, we will notify each state that has and those that have not yet established. We will not, of course, announce this publicly, but we will see that you know fully whether there is such in your state or not.
However, listening to what the chairperson, Nigerian Governors Spouse Forum, Ambassador Professor Mrs. Olufolake Abdulrazak and others have to say.
Combating drug abuse, you will agree with me, requires a multifaceted approach that encompasses prevention, treatment, and support. There is the need also for increased investment in prevention programs that target vulnerable groups, including young people, schools and communities, as well as expanded access to treatment services for those struggling with addiction, while comprehensive public awareness campaign to educate the people should be sustained. It is in this regard that I commend the propriety of the theme of today's capacity building program, community-based drug use prevention and treatment approach, as the integration of this approach will in no small measure improve interventions in phasing out illicit drug use in our communities and create a sustainable pathway to improved care and rehabilitation of drug users. You will agree with me that it is essential to incorporate local stakeholders, including community members and leaders, religious leaders, and community-based civil society organizations in this drive, as dissuading drug abuse is complex and as such requires a comprehensive and multifaceted response. In the light of this, we are employing this approach in Kwara, as it is evident in the advocacy, awareness, and engagement with communities by the Kwara State Drug Control Committee, my office, and the Ajike People Support Center on the eradication of drug abuse in their respective domains.
The aim is to have at least one drug treatment center in our member states. And so far, we have done about 18 in different areas, and some are completed, some are ongoing. But let me come to Nigeria, because we are focusing on Nigeria due to the size and the population. So in Nigeria, we have already done 4 centers, and 3 are at various stages as I speak. But just last 2 weeks or so, we returned from one state where we look at some of the facilities and how we can support to bring it to a functioning state. Already we saw some existing facilities, and ECOWAS has decided to go ahead and support. And it is not limited to only one state or 2. The plan is to have in each of the 6 geopolitical zones in Nigeria, have at least 2 drug treatment centers that we can be part of.
Atanda Babatunde, GTV Africa.